If a patient wants a pessary, a more traditional pessary, what is that? How does your office set up for that? And tell us a little bit about what a pessary fitting is.
So when a patient desires, treatment with a pessary, it takes pretty much a few visits. So they have to come in, and there are a lot of sizes and shapes. It's made out of silicone. There's one made out of latex, but we don't really use that anymore. And they're a little more rigid. But what happens is they have to have a fitting. And so they come into the office. The fitting takes approximately maybe about 30 to 40 minutes because we need to fit them to make sure that it's the proper fit, make sure that it's comfortable. They need to walk around. Some patients I actually instruct to go to the bathroom to make sure it doesn't fall out. And so it tends to be a little cumbersome, and sometimes they even have to come back after a few weeks. Once we figure out that the pessary is working for them, sometimes it just doesn't fit, and so they have to come back to get refitted again. And so there's multiple visits. If patients can't take them out on their own, then they'll come back every 2 to 3 months for us to do it. So there's a lot of visits that occur. It's not a streamlined process.
So you mentioned having to take them out and put them in. So what would a reason be a woman would want to take out an anti-incontinence pessary?
Well, I mean, sometimes what happens is they'll leak with certain activity. So for instance, I have a couple of aerobics instructors that leak during their classes, or even leaking with playing with children. And so, but they don't leak in other places and other times. And so they'll use the incontinence pessary to be able to not leak at the time when they don't want to, and then take it out.